Important information regarding indications for use, symbol descriptions, warnings, and cautions can be found in the Patient Caregiver Information and Instruction Manual. Before turning off the NeuRx Diaphragm Pacing System, make sure the user has adequate ventilatory support. To turn off the NeuRx DPS, press and hold the two buttons on the front of the device simultaneously. Carefully unplug the patient cable from the connector block. Remove the current dressing. Detach the connector block from the connector holder by angling the block upward and slide it out. Clean the exit site with a 70% isopropyl alcohol wipe. Be sure to wipe towards the exit site. Allow the alcohol to air dry before use. Insert the connector block into a new connector holder. Be sure to orient the connector block so the white lines are facing up. Cover the exit site with gauze. The gold pins of the connector block should be exposed. Cover the gauze and exit site with transparent dressing, such as Tegaderm or Opsite. The gold pins of the connector block should still be exposed. Carefully insert the patient cable into the connector block. Orient the patient cable with synapse side up. To turn the NeuRx DPS on, press and hold the two buttons on the front of the device simultaneously. The NeuRx DPS is now providing electrical pulses stimulating the diaphragm. You will notice symbols below the numbers 1, 2, 3, and 4 on the display. Asterisks appear when the pulse is being delivered, and dashes appear in between breaths. Sometimes, depending on settings, question marks can appear instead of asterisks. This is acceptable and not a reason for concern. The NeuRx DPS has prioritized alarms, uniquely sounding an alarm for a high, medium, and low priority alarm. The alarms are both audible and visual. All alarms are important and must be addressed in a timely manner for the NeuRx DPS to continue to function correctly. The higher the priority, the sooner the alarm must be addressed. Before troubleshooting the device, the user should be placed on their form of breathing assistance. If 4 X's are displayed and an alarm bursts 10 times every breath rate, you may have a broken or disconnected indifferent electrode. You should contact Synapse Biomedical at the phone number provided for troubleshooting tips. If there are 1 or more X's displayed and an alarm bursts 3 times every breath rate, you may have a broken or disconnected electrode. You should contact Synapse Biomedical at the phone number provided for troubleshooting tips. If the display reads low battery with all capital letters and an exclamation point, and the alarm bursts 3 times every 30 seconds, the secondary battery is low. Replace the C battery to allow the internal secondary battery to charge. If the display reads low battery and an alarm bursts 2 times every 30 minutes, the primary battery is low. Replace the C battery. Do not get the NeuRx EPG wet while using. You may bathe, shower, or swim, but the NeuRx EPG must be disconnected from the connector holder. The NeuRx EPG is splash-proof but not waterproof. If the exit site gets wet, clean it with a 70% isopropyl alcohol wipe. Allow it to air dry before use. Before bathing, disconnect the patient cable from the electrode connector and cover the wires and connector holder with a waterproof dressing as shown earlier in the video. When you are done bathing, carefully uncover the wires and the connector holder. If you notice moisture on the electrode connector, wipe it with a 70% isopropyl alcohol wipe. Allow the alcohol to air dry before use. Connect the patient cable to the NeuRx EPG by aligning the arrows and pushing the cable into the device. To disconnect, pull the cable straight out of the device. Use your thumb and index finger only when connecting and disconnecting for best results. Do not bend the cable when connecting or disconnecting.